Welcome, future medical laboratory scientists and educators. Today, we're diving into outcomes-based education, or OBE, the foundation of your BSMLS journey. Instead of just chasing grades or ticking off topics, OBE asks a bigger question. What can you actually do when you graduate? This approach ensures that every lecture, lab, and exam is designed to help you become a competent, confident, and ethical medical technologist. Let's explore how OBE shapes your learning and prepares you for real-world challenges in the laboratory. So what exactly is outcomes-based education? William Spady, known as the father of OBE, puts it simply: everything in education should be based on the outcomes we want students to demonstrate. In 2012, the Commission on Higher Education made OBE mandatory in all Philippine colleges and universities. The goal is to move away from a grade-obsessed system and focus on real skills and performance. In OBE, it's not about who scores higher, but whether you can actually perform essential tasks in the lab. Let's compare OBE with the traditional system. Traditionally, students were measured by grades and competition. OBE shifts the focus. Can you perform venipuncture correctly? Can you interpret lab results and explain them to a doctor? It's about real-world competence, not just academic scores. This change ensures that your education is meaningful and directly linked to your future responsibilities as a medical laboratory scientist. The first foundation of OBE is the belief that all students can learn and succeed, though not necessarily at the same pace or in the same way. Some of you might master blood banking quickly, while others need more time with clinical chemistry. That's perfectly normal. OBE gives everyone the opportunity to reach the same high standard, recognizing that learning is a personal journey. The second premise is that success breeds success. When you master one skill, like performing a perfect gram stain, you gain the confidence to tackle the next challenge, such as identifying pathogens. These small victories build your competence and motivate you to keep improving. OBE is designed to help you experience these wins throughout your studies. The third foundation is that schools control the conditions for your success. Your professors and the BSMLS curriculum are carefully designed to provide the labs, schedules, equipment, and support you need. Success isn't left to chance. It's built into the system, so every student has the opportunity to thrive. William Spady outlined 4 core principles that guide OBE in practice. These principles shape how your courses are planned and delivered. They ensure that every part of your education is intentional and focused on helping you achieve real, measurable outcomes. Let's break down each principle and see how they apply to your BSMLS program. First principle is clarity of focus. Teachers start by asking, what exactly do we want our MLS graduates to know, do, and value? For example, in clinical microscopy, every topic points to one clear outcome: the ability to correctly identify and report urinary casts under the microscope. This clarity ensures that your learning is always targeted and purposeful. Second principle is designing down. This means starting with the end goal in mind. What should you be able to do by the end of the course? For example, being able to perform and interpret a complete blood count with confidence. Every lesson, lab, and test is then designed to lead you step by step toward that goal. Nothing is included just because it's tradition. Everything serves a purpose. The third principle is high expectations. OBE does lower the bar. It expects you to reach professional standards, just like those required by the Professional Regulation Commission and hospital labs. But you're not left alone. Your teachers provide all the support you need to meet these high standards, ensuring you're truly ready for your future career. The fourth principle is expanded opportunities. Not everyone learns the same way or at the same speed. That's why OBE offers different activities: video demos, hands-on practice, peer tutoring, extra lab time, and online simulations. These multiple chances help every student succeed, no matter their learning style. Now let's talk about the OBE process, known as constructive alignment. Introduced by John Biggs in 1999, this method connects 3 key parts: defining learning outcomes, designing assessment tasks, and selecting teaching activities. Each part is perfectly aligned to ensure you achieve the intended outcomes. Let's break down each step. Step A is defining learning outcomes. A learning outcome is a clear statement of what you can do at the end of a course or program. In BSMLS, these outcomes include disciplinary knowledge and skills, like performing quality control on hematology analyzers; generic skills, such as communicating lab results ethically; and attitudes and values, like demonstrating honesty and accountability. Step B is designing assessment tasks. Teachers ask, how will we prove students can really do it? Assessments can be formative, helping you improve during the course. Summative final proof at the end, criterion reference measured against standards, not classmates, and authentic or performance-based real lab work, case studies, OSCEs, and portfolios. Rubrics are used to make grading fair and transparent. Step C is selecting teaching and learning activities. These activities are chosen to help you practice the exact skills and the learning outcomes. In OBE, you'll do a lot of hands-on lab practice, group case discussions, role-playing, peer teaching, and reflection journals. The teacher's role is to guide you, while your job is to actively practice and take responsibility for your learning. OBE is all about student-centered learning. You're not just a passive listener, you're an active participant. Whether you're practicing in the lab, discussing cases with peers, or reflecting on your progress, you're always engaged in meaningful activities that build your competence and confidence. Why does OBE matter for you as a BSMLS student? Every exam, practical, and internship is designed so that by graduation, you're not just passing, you're ready to work safely and effectively in any clinical laboratory. Rubrics in every subject show you exactly what's expected, making your path to success clear and achievable. If you become an MLS educator, OBE will guide how you teach and train others. You'll write your own learning outcomes, design fair rubrics, and provide helpful feedback. You'll also create expanded opportunities like extra practice slots to help every student succeed. Your focus will always be on skills, not just grades. Let's see how the OBE premises work in real life. For example, extra lab time is provided for students who need it, ensuring everyone can reach the same high standard. This practical support is a direct result of OBE's belief that all students can succeed with the right conditions. Clarity of focus means knowing exactly what you must be able to do. For example, you might be required to perform a gram stain correctly and interpret the results. This clarity helps you understand what's important and directs your efforts toward mastering essential skills. Designing down means planning your education by starting with the end goal. In BSMLS, this could mean aligning your lessons with board exam competencies. Every activity and assessment is chosen to help you reach these final objectives, ensuring nothing is wasted or irrelevant. High expectations mean aiming for the same level of performance expected in hospital labs. You're trained to meet professional standards, not just to pass exams. This prepares you to be trusted and effective in real clinical settings, both in the Philippines and abroad. Expanded opportunities mean you have access to various learning methods, videos, simulations, peer tutoring, and repeat practice. This variety ensures that every student, regardless of learning style, has a chance to master the required skills and knowledge. Let's recap constructive alignment. Outcomes lead to assessment, which leads to teaching activities. For example, a learning outcome might be to perform a gram stain. The assessment could be a practical exam, and the teaching activity would be hands-on practice in the lab. This alignment ensures everything you do is connected and purposeful. There are three main types of learning outcomes in BSMLS: disciplinary knowledge and skills, generic skills, and attitudes and values. Each type is important for your overall development as a medical laboratory scientist. Together, they ensure you're not just knowledgeable, but also skilled and ethical. Assessments in OBE come in different forms. Formative assessments help you improve during the course, while summative assessments provide final proof of your competence. Criterion-referenced assessments measure you against set standards, and authentic assessments involve real lab work and case studies. Rubrics make the grading process transparent and fair. Rubrics are scoring guides that describe what excellent, good, and needs improvement look like. They make grading fair and transparent, so you always know what's expected. You'll encounter rubrics in almost every subject, from histopathology to microbiology. Use them to guide your learning and track your progress. Teaching and learning activities in OBE are designed to help you practice and master the skills and the learning outcomes. You'll engage in hands-on lab work, group discussions, role-playing, peer teaching, and reflection. These activities make learning active, engaging, and directly relevant to your future career. Hands-on practice is a key part of OBE. Whether you're preparing blood smears, running lab tests, or troubleshooting equipment, you're gaining real-world experience. This practical training ensures you're ready to handle the challenges of a clinical laboratory with confidence. Group case discussions help you develop critical thinking and teamwork skills. By working through real-life scenarios with your peers, you learn to analyze problems, share insights, and collaborate on solutions. These discussions mirror the collaborative nature of healthcare teams in real hospitals. Role-playing with patients or doctors helps you practice communication and professionalism. These activities prepare you for real interactions in the clinical setting, where clear and ethical communication is essential for patient care and teamwork. Peer teaching is another valuable activity in OBE. By explaining concepts and demonstrating skills to your classmates, you reinforce your own understanding and help others learn. This collaborative approach builds confidence and deepens your mastery of the material. Reflection journals encourage you to think about your learning experiences. By writing about what you learned, what challenged you, and how you improved, you develop self-awareness and a growth mindset. This habit helps you become a lifelong learner and a reflective practitioner. In OBE, the teacher's role shifts from lecturer to guide. Your instructors are there to support, mentor, and challenge you. They provide feedback, create opportunities for practice, and help you take responsibility for your own learning journey. As a student in an OBE system, you're expected to take an active role in your learning. This means practicing skills, seeking feedback, and reflecting on your progress. By taking ownership, you become more prepared for the demands of your future profession. Every exam, practical, and internship in your BSMLS program is designed with OBE principles in mind. The goal is not just to help you pass, but to ensure you're truly ready to work safely and effectively in any clinical laboratory. This real-world focus sets you up for long-term success. You'll encounter rubrics in almost every subject, from histopathology to blood banking. These rubrics clearly outline what your professors expect and how you'll be assessed. By reviewing them, you can focus your efforts and understand exactly how to achieve excellence. As a future MLS educator, you'll use OBE to design your own courses. You'll write learning outcomes, create fair rubrics, and provide feedback that helps students grow. You'll also offer expanded opportunities like extra practice sessions to support every learner's success. OBE emphasizes skills over grades. As an educator, you'll focus on helping students develop the abilities they need to succeed in the laboratory, not just on their test scores. This approach ensures that your graduates are competent, ethical, and ready for real-world challenges. Let's quickly summarize the key parts of OBE. Premises: everyone can succeed with the right support. Clarity of focus: know exactly what to do, designing down plan backwards from the end goal. High expectations: aim for professional standards. Expanded opportunities: multiple ways to learn. Constructive alignment: outcomes, assessment, and activities are all connected. Remember, the premise of OBE is that everyone can succeed, and schools are responsible for making that possible. Extra lab time, supportive teaching, and a focus on individual progress are all ways OBE helps you reach your full potential. Clarity of focus means you always know what's expected. Whether it's performing a gram stain or interpreting results, clear goals help you direct your efforts and measure your progress effectively. Designing down ensures that every lesson and activity is planned with the end goal in mind. This approach keeps your education focused, efficient, and relevant to your future career as a medical laboratory scientist. OBE isn't just another educational buzzword. It's the reason BSMLS graduates are trusted in hospitals across the Philippines and abroad. By focusing on what you can actually do, OBE prepares you to help patients and healthcare teams with skill and confidence. Every drop of blood you handle, every slide you read, and every result you report is part of building the outcomes that will make you an excellent medical laboratory scientist. That's the power of OBE. Keep practicing, keep seeking feedback, and keep aiming high. The laboratory world is waiting for skilled, ethical MLS graduates like you.